4 years after the COVID-19 pandemic was declared, federal health officials are relaxing one of their oldest bits of COVID guidance.
13 News reporter Renee Romo explains why the CDC now recommends treating COVID more like the flu.
COVID, the flu, and RSV are now all being grouped together under the term respiratory virus, meaning that the guidelines for the three will essentially be the same. Things like getting vaccinated and staying at home when sick is still highly recommended by the CDC. However, the recommendation to stay home for 5 days if you have COVID is no longer in place.
The period of time you have to stay home is now not defined by a number of days. It's defined by your symptoms, if they are getting better, and fever.
While COVID numbers are going down in Pima County, Dr. Cullen warns that COVID is a subscription service and will continue to be a threat if the proper precautions are not taken. One Tucson resident was hesitant about how seriously people will take the new recommendations.
I think the biggest concern I have is that I'd say the great majority of people feel that COVID and probably other respiratory issues are not a problem anymore. So they're not really taking a lot of precautions. And I prefer to err on the side of caution.
Now, it is important to note that while things have changed for the majority of the public, Dr. Cullen made it very clear that nothing has changed for schools or healthcare workers. In Tucson, Renee Romo, 13 News.